Hello, my name is Shelby and I work for Purdue University College of Education.
And I'm Kate Coleman. I'm a nurse practitioner here at Purdue University Student Health.
So today we're here to talk a little bit more about a very common health concern, skin cancer. So Kate, first, before we actually get started, would you mind telling us a little bit more about what you do for Purdue University and for their student health?
So I am a nurse practitioner, started out as an RN, and I work seeing patients. They come in for an assessment, and I will not only assess whatever current condition they have, but also give advice. And a lot of my advice has to do with preventative care. And when it comes to skin cancer, prevention is the very best. And so as far as skin cancer and what my job goes is I might screen someone for skin cancer and then also educate them about how to prevent skin cancer.
So do you know someone who has skin cancer, or do you know what skin cancer is? Kate, can you tell us a little bit more specifically about skin cancer?
Well, skin cancer really can affect anyone. It's basically an uncontrolled growth of cells that have been damaged and oftentimes damaged by the sun.
Okay, so growth, is that like cell mitosis, cell division?
Exactly. Cell mitosis, that is when you have one healthy cell that divides into two identical healthy cells. But what happens in cancer is there's an interruption in that growth, or actually a checkpoint that's gone, and the growth goes out of control.
Wow, it's so interesting to think that a missing checkpoint could cause something like cancer. So are there different types of skin cancer?
Definitely. There are lots of kinds of skin cancer, but the most important kind to know about is called melanoma, because it's the only form of skin cancer that's really considered deadly.
Well, our viewers are pretty young. What are some of the important things that they should be concerned about skin cancer?
Well, basically, right now is the time to prevent skin cancer. Melanoma, which is the deadly form of skin cancer, is greatly increased in those who have had several bad sunburns when they're young, and especially those people with very fair skin. So when you're young, if you can avoid those very severe sunburns, you greatly reduce your risk for melanoma.
Are there some interesting statistics about skin cancer that we should be aware of?
Yes, there are. So in the United States, 1 in 5 people will develop skin cancer before the age of 70. That's a lot.
Wow. Okay.
And that number's going up, actually. 1 person dies of melanoma every hour in the United States right now.
Wow.
A melanoma-related cancer. The risk of melanoma decreases by 75% when you use a tanning bed before the age of 35.
Wait a minute. Do tanning beds really decrease the risk of skin cancer by 70%? After I heard this suspicious statistic from our expert at Purdue, I did a little digging. I found the use of tanning beds actually increased the risk of skin cancer by 70%. According to the Center for Disease Control, 400,000 cases of skin cancer each year can be attributed to the use of tanning beds. Also, a study from 2016 by Lazovich and colleagues found women under the age of 30 who indoor tan are 6 times more likely to have a melanoma cancer, the most dangerous type of skin cancer.
Melanoma is the second most common type of cancer of young women between the ages of 20 and 29.
Oh, that's my age. Okay.
Yeah, and the age of the students here. And then the risk of developing skin cancer is especially high if you have had the sunburn when you're young.
Wow, thank you for that information. Is there some way to prevent skin cancer? Are there some things we can do?
Yes, unlike many other types of cancer, skin cancer is actually one of those things we do know something about preventing, and that has to do with protecting yourself from the sun's harmful rays. And one of the best ways to do that is not go out at noon or sometime during that middle part of the day when the sun is directly overhead. That is when those rays are the most damaging to the skin. If you're out there in the sun, you can wear a hat, you can wear a long sleeve shirt. They make those protective clothing that you can even wear to the swimming pool, plus wearing a waterproof SPF 30, 70, 90. They make a lot of good protection that you can wear every day.
I like to be out in the sun. I'm very active. And in addition to wearing some of the protective clothing and some sunblock, the waterproof stuff especially, what should I be looking for on my skin to make sure that I'm not developing some skin cancer.
That is a really good point, and that is part of prevention and also early detection of skin cancer. So what you want to do is essentially watch what would be called moles or freckles. Are they changing quickly? Are they bleeding? Are they big? Are they looking really different from one side to the other, really ragged around the edges? That usually can be a sign that you at least need to have it checked out by a skincare specialist. The more moles you have or the more skin changes you have over time does increase your risk for a melanoma. And that again is that deadly type of cancer, skin cancer.
Well, thank you very much for your information. Really appreciate it.
My pleasure.